Oh, Lord. Okay, are we ready?
Yes.
All right. Knock, knock. Good afternoon. My name is Robbie, and I'm a nursing assistant. Would it be okay if I go ahead and empty your catheter bag, measure the contents for the nurse? Awesome. I'm going to wash my hands, and we'll get started. I'm going to pull my curtain for privacy. All right. I'm going to go ahead and open up my bottom drawer. I see the alcohol swabs on the bedside stand, so I'm going to go ahead and grab one of those, and I'm going to put a barrier on the floor. Now, I'm going to use a paper towel. Technically, if you wanted to, you could pull an incontinence pad off of her cart. I wouldn't. It's not necessary. This will be a fine barrier. Okay, so I'm going to put this on the floor. I have my alcohol swab. I'm going to go ahead and just open this up so it's ready to roll. And now I'm going to get my gloves on because I know that everything in the bottom drawer is considered contaminated. I'm going to go ahead and put my gloves on. Now the big thing with the catheter bag is that they want to be sure that no part of the drain touches anything on the floor, and especially inside the graduate. She will bite you hard on points if you let the drain touch any part of the graduate. Now you have a couple of options here, and I'll show you those options. When you pull the graduate out of the drawer, do not touch it like this. You don't touch any part of the inside of the graduate, even with your gloves on. So I'm going to touch the outside of the graduate. I'm going to place it on my barrier. Now, as you'll see, this bag is pretty close to the floor, and it's going to be kind of hard for me to get the bag emptied in the position that it's in. So what I would encourage you to do, and you can do this, is take the bag off of the bed. Now what you got to know how to do is how to open this drain up. This one's pretty easy to open up. And before you leave today, Maureen and we have 3 bags over there, 3 different styles, and you'll be practicing with those to be sure you're comfortable with opening the drain. So now I'm holding the bag, and I'm going to hold my drain. That's this part. This is the part you don't want touching any part of the graduate, and they're specific on that for state, or any part of the floor. So I'm going to go ahead. This particular drain slides left and right. So right now it's closed. I am going to take my gloved hand, hold it down over the graduate, and push it to the left and open up the drain. They want you to empty the entire contents of the bag. Now once I get that done, I'm going to go ahead and close the drain. All right. I'm going to go ahead and hold it as I put it back on the side of the bed, because again, you don't want this thing flopping down and touching the floor, and you don't want to tip your graduate over either. I'm going to just kind of slide this to the side. Notice when I do this, I'm touching the paper towel, not the floor. Now I'm going to get my alcohol swab out. I'm going to go ahead and sanitize the end of this drain. All right. And I'm going to put it back in its holder. That's very important. There's a little pouch right here, okay? Make sure that's not touching the floor. Okay, now this can go in the garbage, and I'm going to pick my graduate up and hold it. And now I'm going to go into the bathroom and put this on a level surface to read it. Go ahead and pause your cameras.